Welcome back, our wonderful viewers. My name is Dr. Love from the Limi Hospital, and with me today is.
Dr. Christiana, consultant hematologist.
So, earlier we were discussing on sickle cell in adults and in children, and we've talked about what sickle cell is. We said sickle cell is a genetic disorder that's an inherited disorder from both parents. That's when both parents um, carry the genes for sickle cell disease and they pass it down to their young ones. We talked about the causes of sickle cell, which is the what's it called, the sickled hemoglobin affecting the shape and form of the red blood cells. Then we talked about the types of hemoglobin we have, the ones we find, the ones we find in newborns and the ones we find in adults. And we also made emphasis on um, the fact that sickle cell can also be tested in newborn by a test we call electrophoresis. So now we are discussing on types of sickle cell. So I'm going to ask um, my consultant here, what are the types of sickle cell diseases now?
Okay, so the types of sickle cell disease, we have the hemoglobin SS, which is a severe form of sickle cell disease, that's the sickle cell anemia. We have other types, the SC. So there are different type of the hemoglobin gene of the abnormal gene. We have the A, we have the S, we have the C, we have the E, and so you can inherit any of that. We have the beta thalassemia. So some are occur in combination. So, but the common ones or the most severe form is the sickle cell anemia, which is hemoglobin SS, which is a severe form of the sickle cell. We have the hemoglobin SC, which is a milder form. Then we also have the hemoglobin, the sickle cell beta thalassemia is in combination with beta thalassemia gene. Beta thalassemia is also inherited, just like sickle cell disease, and an inherited disorder. So you can imagine combination of sickle cell and thalassemia. So you can also have this combination as a type of sickle cell disease, which is sickle cell thalassemia. Then you also just have the sickle cell trait, which is the AS. That is not does not manifest with severe symptoms. Is the person is just a carrier, so it's not really like a form of sickle cell disease. So that is that about the types of sickle cell disease.
So I've had questions from several people about epidemiology of sickle cell. You know, some will tell you, oh, when I got married to my white woman, there was no counseling on sickle cell and the rest of that. So, which brings us to epidemiology. Where do we have sickle cell gene? Who are the kind of people that can pass down this sickle cell gene?
Okay, so sickle cell disease actually started from the from the western region, but right now, due to globalization, it's like a worldwide thing because of intermarriages. So it is commonly seen in the from the African region, from Indian region, from the African Americans. Those are some of the places you can see more of sickle cell diseases in the sub-Saharan region, towards the middle belt. So, but as I said, it occurs worldwide. It can happen anywhere. But those are some of the places that you could see sickle cell more in the world.
So we want to move over to signs and symptoms. That's what to see, what to expect. So, Chief, when they come to your clinic, what do you see? What are the symptoms that they present with?
Okay, so symptoms and signs of sickle cell disease actually the presentation occurs in various ways. Presentation can occur from 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 childhood. That is, as a child is giving birth and he has sickle cell disease, by the age of maybe about 3 months, already he begins to present with swelling in the hand and foot, which is called hand and foot syndrome. So that's one of the common symptoms that occur in sickle cell disease. hand and foot swelling. Then subsequently, one of the common presentations will be painful crisis. Even as a baby, they can present with pains. They might not tell you they have pains, but they can cry because of pain. Pains either from abdominal pain or bone pain. So they can just be crying. But as they grow older, they can complain that they have pains. So most common presentation is bone pain. That is one of the common symptoms you see from a sickle cell disease patient. But there are other different forms of presentation depending on what is going on in the body. Because one of the common things they have is anemia. Because as we said, the sickle cell anemia, they present with low blood level. And the reason is because we said the red cell carry the oxygen to the tissue. But when the hemoglobin is abnormal, the red blood cells is now destroyed earlier. The half-life of a normal blood cell is about 120 days, but a sickle cell red blood cells like half-life is just between 10 to 20 days. So this get destroyed very easily, and then it leaves you with low blood level in the body. And so most of these patients will either present with anemia because they have low blood level. So some of the symptoms of the anemia they present with is either weakness, that is for the adult people. They can tell you they've been weak, or they come down with jaundice depending on the type of anemia they are in, because some of them can present with hyperhemolytic anemia, or is a hemolytic process going on. They can present with hyperhemolytic crisis. So they can present with dark color urine, yellowness of the eye. So those are some of the common presentation that they can come down with. And then from that, you know that maybe this, when you do the test, the PCV, you now find out that the blood level is very low. So as I said, depending on other a kind of presentation, they can come with chest pain. Maybe when they have chest infection, or they have what is called acute chest syndrome. They present with chest pain, they can present with cough, they can present with difficulty in breathing. They can also present with pain maybe around the joints or the hip, because sometimes they come with complication called avascular necrosis, which we'll talk about it later. So depending on what they present with, some males can present with what we call priapism, painful, sustained, purposeless erection. So that is just what the patient will come with. So they present in different ways. That is some of the presentation or sign and symptoms of sickle cell disease.
Okay, thank you very much, man. Also, to add to what she has said, we also see them coming down with frequent infections, and this is as a result of damage to an organ we call the spleen, which is as a result of course, the sickle shape of the red blood cells. We also see in some of them, that's in children, they have delayed growth. That's because the red blood cells that provide nutrients and oxygen to the body is impaired. So, moving over, we want to talk about how to diagnose sickle cell. So, when you come to the hospitals with these symptoms and with these signs, what do we check for? Which investigations do we send to the lab? How do we diagnose them?
Okay, so to make diagnosis of sickle cell disease, when either a child present or an adult present with some of these symptoms, ab initio, some know that they have sickle cell disease. Some usually do not know, because sometimes we can even diagnose them in their adulthood or in the teenage age. Some can just present by 16 years. That is when you are diagnosing them. We have also diagnosed people like at the age of 50 something. That is the people carrying the SC, because as you said, that is not the severe form. So they were carrying the gene, but they didn't know until at that age when we tested them, and then we found out that they actually have sickle cell disease. So basically, when they come, you want to take sample for investigation. One of the common tests we want to take first is we want to do a full blood count. We want to send sample for blood film. So when you do a full blood count, commonly you find out that the blood level is low. That is, the PCV is very low. Some can be as low as 10%, and that is how low it can go. So from that, you can begin to wonder, because of the presentation already of bone pain, yellowness of the eye, you have examined and you have noted that this patient from the facies, because they have what is called sickle cell facies. Some have protruding of, basal, we call it basal bursing. So some of those symptoms that you see or the features that you see makes you think, ah, this patient most likely has sickle cell disease. So when you do your own blood film, you can see these sickle cells in the blood film. And then so basically you can now go to do further investigation, because not all the time people ask for genotype. You know, you have to start with the full blood count, maybe ask for a blood film, then you also ask for a genotype. You can do a normal straightforward genotype. Currently we have even point of care tests to do genotype. Within 5 10 minutes you can have your result of the patient, either his SS or his SC. So simple genotype, you can do that, and then you find out that the patient has sickle cell disease. There are other higher tests that you can do, which is the hemoglobin electrophoresis, which is the high performance liquid chromatography that gives you the quantification of the levels of the hemoglobin. So that is very the most accurate test that we need to do to confirm that the patient has sickle cell disease. So it will tell you about the percentage of the sickle cell, most of them ranging from 70 to 80, because we said the predominant hemoglobin now, it will now be that of the sickle cell. Then we just have maybe some few percentage of the um, adult hemoglobin, and then a little percentage of the fetal hemoglobin. Usually the fetal hemoglobin is more in the neonatal age, while in the adult is less, because the adult hemoglobin ideally is supposed to replace the fetal hemoglobin. So those are some of the investigations you can do just to make diagnosis of the sickle cell disease. But when they come for, come with other complications, there are still other further tests that you need to do.
All right. There's this question that we get regularly also from non-medical people, that in some people who claim their AS, sometimes they complain of crisis, bone pain that is similar to sickle cell. So it could other forms of sickle cell traits, could they also show up with complications from having sickle cell, like AS patients?
Okay, most of the times those that are just carriers actually hardly present with bone crisis, but we have seen a few that have actually presented with bone crisis just because of the sickle cell. The sickle cell actually in the body, as we know, when there's a reduced oxygen, the sickle cell get worsened, becomes irreversible sickle cell. It leads to deoxygenation of the cell or the tissue. It leads to ischemia, infarction, and then leads to the pains that the sickle cell patient experience. So because this AS patient or AS individual is still having those sickle cells, so it's still possible for him to have some form of pain due to that ischemia that sickle cell causes. Okay, so but commonly it's just the SS and the SC that present with more severe symptoms. Then occasionally the hemoglobin S beta thalassemia. Those are the people that actually present with sickle cell symptoms.
So by the time we establish the diagnosis of sickle cell, what do we tell them to look out for complications of sickle cells? What are the complications we see commonly in our line of practice? That's in sickle cell individuals.
But there are quite a number of complications that occurs in sickle cell, starting from the head down to the toe. Quite a number of them. Sickle cell patient can have stroke. It's not only patient with hypertension that have stroke. So a sickle cell patient can have a stroke. And this stroke usually occur because of these sickle cells that block the flow of blood to the brain area, just like it blocks the flow of blood to other organs or tissue, causing all the damage. So when you have blockage to the brain cells, it can cause stroke. So stroke can occur as young as 2 years of age. So we have seen 2 3 years coming down with stroke. We have seen adults coming down with stroke, even though stroke is commoner in the adult age group. The stroke can either be an ischemic stroke or a form of hemorrhagic stroke. And then when they present with stroke, some of the symptoms they can present with is seizures, weakness, numbness, sudden loss of speech, loss of consciousness, just like the normal presentation of stroke in adults, any form of hypertension, crisis, or anything. That's kind of complication they can present with, or the symptoms they can present with. They can also present with what we call acute eh, retinopathy, sickle cell retinopathy. That's the affectation of the retina,
Yes.
yes, of the eyes. So some of them even come down with blindness, and that's why we say it can affect any part of the body. They can have what is called they can present with what is called acute chest syndrome, is a form of complication of sickle cell disease. Some of these patients come with cough, difficulty in breathing, fever, or some can just start with normal crisis, bone crisis, chest infection, and then suddenly they go down with acute chest syndrome. It's one of the fatal complications of sickle cell disease, and it can kill very fast. They can also come down with what we call pulmonary hypertension. Just like you have high blood pressure, you can have high blood pressure in the lungs. So that is a form of presentation or form of complication of the sickle cell disease, which this occurs usually after a long time of deoxygenation of chronic anemia. So usually this patient we can present with difficulty in breathing, low oxygen level, cough, and all that, just like a patient with acute chest syndrome. Sometimes you cannot even differentiate a chest infection and a pulmonary hypertension. The other complication can be a gallstone. The red blood cells are excreted in form of bilirubin. So this bilirubin can form and are deposited in the gallbladder. So patient can have complication called cholecystitis. And then they can present with pain on the right hypochondrial region or on the upper abdomen, right abdomen. So this common presentation, most likely the patient has a gallstone. So when you do an ultrasound scan, you find out that the patient has gallstone. That's one of the common complications too they can present with. They can also present with leg ulcers. Um, these leg ulcers can even affect the bone and lead to what is called osteomyelitis. That's also one of the common complications they can present with. I to also mention that they can present with priapism. Priapism is he said is a purposeless erectile dysfunction. Of course, it's purposeless because at that time you don't need it, but because of increase in blood flow to this organ, either from the risk factor from stroke, I mean from drugs, or even from the sickle cell disease on its own, it can lead to priapism. So it can have be one of the complications, and eventually it can lead to incompetence. That's rectal incompetence. So those are some of the complications of sickle cell disease.
So from the last thing she said, this is a from the last thing she said, this is a warning to young men out there that are sickle cell and that are diagnosed of sickle cell. So please do away with every form of herbal concussion that will lead to erection, do away with drugs and the rest of that, because you are prone to what we call priapism, which is purposeless erection which lasts for long. Now, let's move over to treatment of sickle cell disease. So, hello, viewers, if you are just joining us, my name is Dr. Love, and with me is Dr.
Udop Christiana, consultant hematologist.
So we are from the Limi hospitals, and we are discussing sickle cell and management of sickle cell. So what we've been talking about since is what we find in sickle cell patients, how we diagnose them, and the management, of course. So if you are just joining, welcome, welcome, welcome. So we are talking about the treatment of sickle cell right now, and that is where we are. So, Chief, what are the treatments of sickle cell? We've talked about the complications, we've talked about the signs and symptoms. So, how do we manage the signs and symptoms when they come into our institution?
Okay, so the treatment depends on the type of presentation. Most of the times, as I said earlier, they present with bone pain. And then there are some of the risk factors of sickle cell disease. Dehydration is a risk factor, exposure to infection is a risk factor to that. So normally when they come, you have taking your history, very good history. You have examined your patient. You have taken sample. You have sent your test to the lab. You need to manage this patient. The first thing we want to do is want to set an IV line and hydrate the patient because most of them the pain is caused by dehydration. So we want to hydrate the patient. So you need to give IV fluid for hydration, and that hydration helps to relieve the pain. Beside that, one of the common treatment is the analgesics. When they are in pain, usually we give what is called the pain relievers, drugs that will relieve the pains. These drugs are ranging from NSAIDs, non-steroidal anti-inflammatory drugs, such as ibuprofen, diclofenac. Those are some of the drugs that can be used. Then we can have opiates in most severe symptoms or severe pain. When we ask for the, usually ask, what is your pain score? On the scale of 0 to 10, what is your pain score? When you tell us that your pain score is 10/10, some will even tell you it's 15/10. That's to tell you how severe the pain is. So depending on the severity of your pain, we give you your analgesic. So we can give you your diclofenac suppositories, we can use the opiates, morphine. Occasionally we can give pentazocine because that helps to reduce the pain immediately. So we can give that as one of the pain medicine. We can also give you, we can also um, we can also give we can also give we can also, depending on the other things you can present with, that we think maybe you have a form of infection, we can give you antibiotics. So we treat the infection that you're coming with, especially if you have a chest infection. But we need to understand that virtually all sickle cell patients come with a mildly elevated white blood cell. So that doesn't mean they have infection. So depending on the symptoms of infection that you have, that is when we can give you. Maybe you have an ulcer in the leg that is looking infected, where you have cough, difficulty in breathing. Maybe you do a chest x-ray and we find out that there are signs of infection because they commonly come down with pneumonia, so we can give them antibiotics. So those are some of the drugs we can give when they are in crisis. But there are other drugs, routine drugs that we usually use for the treatment of sickle cell disease. We use our usual folic acids for drug treatment. We we use
Haematologist.
hematinics. Usually, you don't really want to use so much of hematinics, especially the iron,
Mm-hmm.
because they already have enough iron in their body. So we can use their routine medications, which most of them, when they come to the hospital, we tell them that you have to take these drugs every day. Malaria prophylaxis. We have some of the common drugs that we use. One of the most acceptable drug for sickle cell disease is hydroxyurea, which we also use commonly. So those are some of the treatment of sickle cell
Sickle cell.
disease.
So please and please, one thing we are emphasizing is this: is when you have this crisis, visit the hospital. We visit the hospital around you, because some of these things cannot be self-managed at home. You could want to manage these things at home, and you are dealing with complications, and you require a specialist, you require a doctor to be able to handle all of these. All of these complications. And of course, we also ask you to go to your clinics regularly because, like she said, there's an emphasis on prevention of malaria because um, sickle cell patients are prone to malaria. So we place them on prevention of malaria. So the common question we always have is there any cure for this disease? Because it's an inherited disease. Is there something that could be done, or is there something medicine has come up with that can actually cure this disease totally?
Yes, there's cure for sickle cell disease. One of the um, method of curation is a bone marrow transplant. So bone marrow transplantation can cure sickle cell disease. So the bone marrow transplant can be done either from an identical sibling, or from a twin, or that is the allogeneic type of bone marrow transplant. Then we even have the haploidentical. Currently, even parents can be used. Unidentical siblings can be used for bone marrow transplant. So bone marrow transplant can actually cure sickle cell disease. That is one of the most curative methods. There's also what is called gene therapy. Gene therapy, we say, is a genetic disorder. So if you change the gene and infuse a normal gene to the individual, he can be cured from sickle cell disease. So gene therapy can also be used to cure sickle cell disease. Unfortunately, both methods are very, very expensive. Bone marrow transplantation, sickle cell disease are quite very, very expensive, and it's not really affordable by so many. And that is why most people have not had bone marrow transplant for curation of sickle cell disease. So those are some of the methods that we can use to cure sickle cell disease.
So, from the discussion on curation and the rest of that, since we already know that this method, the method of curation is expensive, and of course, we are in a developing country. So, what are the things we can do to prevent sickle cell? What are the measures we can take as individuals to prevent sickle cell?
Okay, so prevention of sickle cell disease is a bit complex because before you realize that before you realize you're carrying the gene, and maybe you're already dating someone that is carrying the gene of sickle cell disease, and maybe you're preparing to get married, and then you go for counseling, and or you go for test, and they ask you to go and do tests, and then you come down with your results, both of you are AS, and then you know that there's a problem at this time. So it is difficult now to prevent you from marrying, and so the prevention of sickle cell disease will be difficult. But one of the most important method of prevention is creation of awareness. We need to create more awareness. Awareness of sickle cell need to start even from primary school, secondary school, the university. That is one of the ways that we can prevent sickle cell disease. When the public or the people are aware that they have this gene, an abnormal gene, sickle cell disease, even before you prepare to go into courtship, you are very much alert that no, I am AS, and I have to be sure that who I'm marrying is not AS. Because when you marry an AS, you have 1 to 4 chance of having a child with sickle cell disease. That's you have a 25% chance of giving birth to a child that has sickle cell disease. So, but if you know that you are AS, you will target to go into marriage with someone that is AA. But if you know you're AA, you don't have a problem, because when you marry an AS, you can only have a carrier. Even when you marry an SS, as far as you're AA, you're only having a carrier, not a sickler. So one of the most important way to prevent is creation of awareness, and then preventing getting married to someone with avoiding getting married to someone with sickle cell disease. That is one of the other ways that you can do to prevent sickle cell disease.
So, from all she has said, it's important to note that the three basic genotype your spouse will tell you is AA, AS, or AC. So, what we're talking about here is compatibility. When you're looking forward to spiritual compatibility, physical compatibility, also look into medical compatibility. So basically, what we've said is when you are AS, you should be looking for someone with AA genotype. When you are HC, you should be looking for someone with AA genotype. Then for SS, of course, the only candidate you can marry is AA. So with all this being said, if you are just joining us again, this is Instagram Live of the Limi Hospitals, and my name is Dr. Love, and with me this evening is Dr.
Christiana, consultant hematologist.
So we've been discussing on sickle cell diseases. We've talked about what sickle cell is. We've talked about the causes. We've talked about types of sickle cell disease. We've talked about signs and symptoms, even possible complications from sickle cell disease. And we also talked about the treatment and the management, things to check out for, and of course, to always come for your regular clinic, always use the drugs as prescribed by the doctors. Then we also talked about cure, which of course um, in this um, in this in this part of the world we've said is very expensive, and of course what we are looking into is prevention, and to doing that we've been creating awareness. We need to create more awareness on what sickle cell is and how it could be actually passed down. We said is an genetic disorder which you inherit from your parents, both of your parents, when they pass down these sickle cell diseases to you. So we are using this medium also to ask our viewers if you have any questions for us, please drop them on the Instagram live and we'll be responding as such. So I also want to ask, what are the Chief? What are uh, the things that sickle cell could do? The kind of diet they should eat. What are the little things they could do? Should they avoid cold? Should they should they sleep under air cons? Those basic house things that you think we could educate the population about.
Okay, so there are predisposing factors to crisis. So these predisposing factors need to be avoided. And one of such we said is dehydration. So we encourage sickle cell patients to drink a lot of water. They need to drink at least 3 liters of water in a day. Um, Renal complication is one of the complications which I had missed out. You can have kidney problems when you're not well hydrated too. So you need to get well hydrated so that you can avoid having complications with your kidneys. So you won't have complication from hypovolemia from lack of fluid. So we encourage sickle cell patients to take a lot of water because dehydration predisposed to sickle cell pain. Another thing they need to do is to avoid stress. Stress can worsen your crisis or initiate crisis. So, as much as possible, avoid a lot of stress. We're not saying you should not work, we're not saying you should not do exercise, we're not saying you should not do one or two things to keep yourself busy, but don't do it to the extreme because it can worsen your crisis or it can predispose you to crisis. Ordinary menstrual pain like is a form of stress and it can also worsen your crisis. So for females that have their monthly cycle, we encourage them to take their analgesic just before your menstrual period so that it can reduce the pain of sickle cell disease, I mean of the menses, especially if you usually have dysmenorrhea. You will better take analgesic to reduce your pain so that it will not predispose you to having crisis because we have a lot of young ladies coming in with vaso-occlusive crisis just because they are on their periods. Another thing that we need to avoid is a sickle cell patient should sleep under mosquito treated nets because as we said malaria infection can worsen your crisis and then you are also prone to malaria infection. So it's better for you to stay under mosquito treated nets despite the fact that you are giving a malaria prophylaxis. You still need to prevent yourself from getting malaria infection. So those are some of the things you need to avoid. Food wise, you can eat virtually everything. There's no so much contraindication to the food you will eat. The only thing is we usually tell our patient not to take something that contains too much of iron because you already have a lot of iron in your body. And then because of constant transfusion, you can also have a lot of iron in the body. So one of the complications also is when you are being transfused frequently, you can come down with iron overload. So we usually want to tell you that avoid iron as much as possible. I avoid iron drugs except if it is very, very necessary. So basically, those are some of the things you will need to do to prevent sickle cell crisis.
So, well done, viewers. We've already told you things you can do in your houses to prevent crisis. Hydrate, hydrate, hydrate. Drink lots of water. Use your malaria preventive drugs. Use malaria preventive measures such as mosquito nets. Then also stay safe out there. Uh, Chief, there's this question I also want to ask as regards sickle cell and pregnant women. Is there any thing they should look out for ladies who have sickle cell and are pregnant? What should they look out for? Are they crises that could occur in pregnancy, or does pregnancy makes the sickle cell disease worse?
Okay, so for someone who has sickle cell disease, he can get pregnant normally, like every other person. So sickle cell disease is not contraindication to getting pregnant. So, but when you get pregnant, you have to book for your antenatal very early, and you need to take your routine medications because it is possible that you can come down with anemia. Most of the times, pregnant women come down with what we call anemia in pregnancy. And for the fact that you have sickle cell disease, we said earlier on that the red blood cells in sickle cell gets destroyed very fast, earlier than someone with normal red blood cells. So you can easily come down with very low blood level. So, but when you take your routine medication, it can prevent you from coming down with this low blood level. So you need to go for your routine antenatal care, and at any time you have crisis, you see your doctor, you'll be given some pain medicine, and know that there are some pain medicine that cannot be used in first trimester of pregnancy, so that needs to be avoided. But you can only know that when you go for your antenatal clinic. So we encourage everyone who is pregnant to go for your routine antenatal check, so that when you have pain, when you have malaria in pregnancy, it can also be treated. When you need to be transfused, when your blood level is low, you can be transfused, and then that can sustain the pregnancy to term, because anemia can cause so much problem for your unborn baby. So we usually optimize you. You must maintain your steady state PCV. If your PCV is going low, you have to be transfused. And then sometimes when you carry this pregnancy to delivery, some may have cesarean section, some may have normal delivery. And cesarean section also predispose you to crisis. So, but when you're on admission and then you're managed accordingly, we can reduce this kind of pains that occur with pregnancy in sickle cell disease patients. So sickle cell patients can carry their pregnancy normally, they can deliver normally, even though with some form of stress, vaso-occlusive pains, or malaria or anemia in pregnancy.
Okay. You made mention of stable state PCV or steady state PCV. So because I've seen patients that come into my clinic and and we ask for their stable state PCV. Those are the ones that have been going for regular checkups, and they're able to communicate their steady state PCV too. So how do we come about saying this is your steady state PCV?
Okay, so usually the normal PCV in sickle cell disease, we call it steady state PCV when you do your PCV in your usual healthy state of mind. Maybe within the last 4 to 6 weeks of your, or 4 to 6 weeks, you're fine, you don't have crisis, you do your PCV, and maybe your PCV is now 20 or between 20-22%, and every time you're stable, that is what your PCV remains. But when you have crisis, your PCV can go lower. So that steady PCV is what your body is already used to. You don't have problem when you have that PCV, because ordinarily someone that is normal, that is not a sickle cell patient, cannot survive with a PCV of 12%. But we have seen sickle cell patients with PCV of 12%, 16%. That is their steady state PCV. 20% is their steady state PCV. The body is already used to that normal PCV, so they don't have problem with that, and that is usually their steady state PCV. So that is about steady state PCV.
Okay. If you are just joining us again, this is the Limi Hospital's live, and we are discussing sickle cell diseases in adults and in children. So we've discussed basically what sickle cell is, the causes of sickle cell, the types of sickle cell, and the how we diagnose sickle cell, the complications, if there is cure, and we've said there are cures to there are modalities of cure to sickle cell, which in this population is quite expensive. We talked about prevention, how to prevent sickle cell. Since it's a genetic disorder, you want to know the genotype of your spouse. Even those are questions to ask when you are going into marriage with your spouse. We also talked about sickle cell in pregnancy, that a woman can carry pregnancy up to term, she can deliver normally, she can even if it boils down to CS, she could also have CS. We talk about the crisis they could have in pregnancy, and all of this should be managed by a doctor, should be managed in the hospital. So we advise you to always seek the consult of a doctor. So we are also welcoming questions from our viewers online, and the questions that are coming in, we are also going to be responding on this live. So one of the questions we have is, if sickle cell trait is not an illness, why are people tested? So, Chief, you're going to help us out with that. If sickle cell trait is not an illness, why do we test people? Why do we tell them to go to the hospitals for check to know their genotypes?
Okay, so sickle cell trait is not an illness. You are just a carrier. But the reason why it has to be tested is because when you're carrying the gene, sickle cell trait, you must know before you can take action. So if you don't know that you are AS, how will you be able to marry someone that is not an AS? So that is one of the major reasons why it has to be tested, despite the fact that it's not a disease or it's not an illness. So you must be tested because, as we said, sickle cell disease is inherited from both parents, inheritance of an abnormal hemoglobin. So the S there already is abnormal, and then someone might also be having the S, which is abnormal. And then by the time you get married, you can transfer this abnormal gene to your offspring. And then we want to prevent sickle cell disease, and that's what we're talking about. One of the preventive methods is awareness, counseling, and testing. By the time you're tested and you know that you are a carrier, you avoid getting married to someone who is also a carrier. You either look out for someone who is normal, having a normal hemoglobin, which is the AA, not SS or SC.
So, like I said, you can be a carrier. You can have S in your genotype that is AS. So you have to be tested so as to know the kind of spouse to look out for and to reduce the incidence of sickle cell in the younger generations. Which I think we've been achieving that, and with more awareness, with more creating awareness to the population, we can achieve a very low incidence of sickle cell population. So we are still welcoming more questions from the viewers. We are still welcoming more questions from the viewers. I think one of the questions we have is, what medical problems are caused by sickle cell diseases? So we've talked about lots of medical problems that they could have. We've talked about the crisis, the bone crisis, they come in bone pain. We've talked about organ affectation, that's the eyes. Sickle cell can affect the eyes. The sickle shape of the red blood cells starts to block vessels of the eyes. It could even lead to blindness. We've talked about the chest pain, that's the acute chest syndrome. They could come in respiratory distress. They could come in even chest infections, because sickle cell population are prone to infections. So they will come in chest infections. Then the reason why they are prone to infections, we've talked about the organ affectation, like the spleen. It affects the spleen, which is one of the organs that helps us fight infection. So when this spleen is damaged by the sickle cell shaped red blood cells, it leaves the sickle cell individual prone to infections. We've also talked about leg ulcers, that they could be prone to leg ulcers as a result of the sickle cell shaped red blood cell blocking the blood vessels to the leg. So all of these things are um, things we see in sickle cell population. We also talked about complications, different complications. It could cause stroke. That's when there is obstruction of blood to certain tissues of the brain. And of course, they come in with seizures. We've discussed that. They come in with seizures. They come in with weakness of the limbs, that's the hands and legs. They come in slurred speech. And we said the stroke can affect as young as 2 years old. And of course, it could also happen in sickle cell adults. So these are few of the complications we discussed. So Chief, do you want to add any other thing to um, what are the things they could have, like other complications you discussed earlier?
Okay, so I had mentioned that we left out um,
renal
renal
complications. Okay.
complication. So it is also one of the common complications that occur in sickle cell disease. So some of the ways we can prevent all these complications from happening is starting to check for them very early. So we could do urinalysis to check for proteins in the urine, microalbuminemia, and all that. So, as we said, regular routine checks can help you prevent some of these complications. And then we can avoid some of the drugs, the nephrotoxic drugs, the drugs I mean that affect the kidneys, like the diclofenacs that we said can also destroy your kidneys. So because of that, you we advise you to take a little of them, and then you can only take that with a doctor's prescription because they can also damage your kidneys. So kidney problem is one of the complications that can occur in sickle cell disease. You can have just an acute kidney injury which can be reversible, maybe with some hydration, um, and then maybe some little few drugs. But this kidney problem can worsen and you can get to what we call chronic kidney disease. And at the end of the day, you must have a kidney transplant. So it can become so bad that only transplant can help. So we usually don't want you to get to that level of developing chronic kidney disease or end-stage renal disease that you must have a transplant. Already we're talking about having a bone marrow transplant. So you can imagine having two forms of transplant, a bone marrow transplant, a kidney transplant, just because of chronic kidney disease. And then usually sometimes chronic kidney disease can also lead to hypertension. So it's either way. Some have hypertension can also affect the kidney. Some have kidney disease can also
Cause
cause
hypertension.
hypertension. So when you are hypertensive, you also take your drugs so that it can help reduce affecting the kidneys so that you won't have acute kidney injury or chronic kidney disease, which can worsen your sickle cell problem. So those are some of the complications that can occur or medical problems that can occur with sickle cell disease. I know that we also have, this is not really medical, the issue of stigmatization
Stigma.
can also occur for patients with sickle cell disease. We know a lot of patients that are not happy because they have been stigmatized. So it's one of the things that also affect them psychologically. So, well, it's both medical and psychological. So, medically, they can have psychological issues and they need to see either the psychologist or the psychiatric to counsel them because so many of them can have depression from the frequent bone pain, and then maybe some are worried about maybe they think they cannot live their normal life, or they will die young, or they will not live up to the normal life for the normal human beings. So they get depressed about that because I know so many people that have asked me, can I how long can I live with sickle cell disease? And I've told them, you can live as long. We've had people living up to 60, 70 years, 80 years, depending on how you manage yourself and how you prevent these complications from happening, and then how to manage those complications. So you can live as long as possible as a normal person. Yes, but depending on the complication that can arise. If you prevent them, we can prevent mortality, early mortality. So those are some of the things that can occur in sickle cell disease. We have found a lot of sickle cell disease patients that abuse drugs, abuse most especially the opiates. So drug abuse is a major challenge, a medical challenge in sickle cell disease patients. So we always encourage you and advise you, please do not abuse drugs. Go to the hospital when you have pain. The doctor knows you have pain, and we're going to give you drugs to manage your pain. Don't abuse drugs at home. Go and see your doctor. The doctor will manage your pain for you, and he will tell you how you can also manage pain without abusing drugs.
Okay. Chief, there's a question we get regularly, especially from the youngins, with the use of drugs and alcohol intake. So, what would you have to say about sickle cell and alcohol consumption? Of course, illicit drugs. Um, just to educate them on which is bad and which kind of lifestyle to keep as regards alcohol consumption and illicit drug intake.
Okay, so we have talked so much about drugs. We have said it earlier on. We should not abuse drugs. We also have drugs that affect the kidneys. We have drugs that can cause priapism. Some of the marijuana, cocaine, not only those drugs, there are even some medical drugs that
Drugs.
can cause priapism. So you need to be guided by your physician or by your doctor about the drugs that you need to take. So taking drug unnecessary or drug abuse is not right. And the same thing with alcohol. Alcohol on its own is also bad. So I can't imagine you are a sickle cell patient, you're having crisis regularly, and then you get drunk or you take excessive alcohol. There's a problem. Already we said both the drugs, the disease can affect all any part of your organ. It can affect your liver, it can affect your kidneys, it can affect every part of your body. And then when you worsen the problem with alcohol intake, you worsen the complications. And then at the end of the day, you shorten your lifespan. So both alcohol and drugs that are not prescribed or drug abuse can affect the individual with sickle cell disease.
Okay. One other question I want to ask you is there any recorded life expectancy for people with sickle cell? Is there a level at which an age they are not able to attain, or can they live their lives normally even up to 80s, 90s, and the rest?
Okay, I've said it earlier on that sickle cell disease can live their normal life. That is, if we prevent some of these complications from happening. Some of them, the complication might not be prevented, but the majority of those that can be prevented should be prevented, and then this complication will not lead to mortality, or rather, it will prolong your lifespan. So, sickle cell disease patient can live optimal life. They can live like an adult, I mean, normal adult without the sickle cell disease.
Okay. All right, well done. Hello, our wonderful viewers. Today we are discussing sickle cell disease, and this is the Limi Hospitals. My name is Dr. Love, and with me is
Dr. Udo, Christiana.
Dr. Udo Christiana. So we've talked about sickle cell. We've said what sickle cell is. That is a genetic disorder. You inherit it from both of your parents. That's when your parents are AS or ASSS, or even ACSS, ACSC. So those are sickle cell traits. And when such people marry, they tend to have offsprings or children that are sickle cell. We've talked about the types of sickle cell. We talked about sickle cell anemia, that's lack or short of blood in sickle cell diseases. We've talked about the things we look out for. Even in children, you can have swollen joints, that's dactylitis, that's the big hands in children where their joints are swollen, and even pain. We even said newborns, they are not able to communicate the pain, but you see them cry a lot. So those are the things you look out for in your children. We also talked about facies, that's how they look and all of that. So when you notice all of those things, please come to the hospital. If you are noticing recurrent infection in your children, come to the hospital. Then we also talked about how we diagnose these diseases. We talked about several lab investigations. We talked about the complications of this disease, the organs they can affect, the eyes, the chest, the respiratory organs, the lungs, can lead to infections. Talked about organs affectation like the kidneys, even the liver, then the spleen. We talked about things you can do in your everyday life, consumption of lots and lots of fluid, drink lots of water. We even gave a recommendation of at least 3 liters per day. That's even in an healthy individual. We expect everybody to at least consume 3 liters of water per day. Then we also talked about other things you could do. Go to the hospital. You should be on malaria preventive medications. There are also things you could do in your houses to prevent malaria, because as sickle cell individual, you are prone to malaria infections. So you want to sleep under mosquito treated nets. You want to fleet your house. You want to fumigate your surroundings. You You want to keep
It's a
your
no.
environments clean, your gutters. You want to make sure your drainage are clean. You don't want to keep stagnant water around your home. You want to clear bushes. These are things you can do to prevent mosquitoes logging around your houses, and in turn, you are preventing malaria. We also talked about cure of sickle cell. Yes, there are cures, there are curative modalities. We talked about bone marrow transplants. We talked about genetic modifications. That's where we modify the genes that causes sickle cell. And all of these things, we said they are expensive, and there are even complications to this surgery. So the best form is the prevention. Prevention, and that is why we are creating awareness, and we are telling the population to go and check your genotype, especially those of marriageable age, those looking for spouse. Apart from your physical compatibility, your religious compatibility, you also have to check for medical compatibility. And the basic uh, investigations when you go to the hospital as spouse